Hi guys, welcome to my channel. It's Sumit Kumar Khandai. Today I'm just going to start pharmaceutics and pharmaceutics. I'm just going to start tablets. So if we're going to tablet, I just want to know the history of the tablet. Means how the tablet never come the first in previous time. They never use as tablets. Our ancestor never uses a tablet as a dosage form. So in the ancient Greece, in the ancient Greece, they take some what are they take some medical and medicinal ingredients and they mixed up everything and they mixed up everything and they scroll down in their hand means by using their hand they make a very spherical structure. The spherical structure now we're knowing it as pills. At that time it is known as the spherical structure is known as catapotia. Their spherical structure in the ancient Greece known as catapotia. So, what is the meaning of kataputia? The kataputia meaning something to be swallowed. Something to be swallowed is known as kataputia. So, according to the time, the kataputia name was given by that Roman scholar Pliny, and according to the name of Pliny, now we are naming that spherical structures pills. So the pills was gone, and another thing, uh, who discovered the tablet? Who discovered the tablet? First, the first who discovered shaping of pills was first invented by a British painter. The shaping of pills was first discovered by a British painter named as William Brockedon. Named as William Brockedon in 1843. So he discovered the means tablet, a shaping of the pills. So the history was gone. Now I am going to the types of tablets. What are the different types of tablet? Uh, there are a lot of different and mainly according to the route of administration, uh, the types of tablets are getting divided. What are different type of tablets? Tablets ingested orally. Mainly we just ingest a tablet orally first. Another thing, the tablets used in our the tablet we use in our buccal cavity, oral cavity. Third thing, the tablet we use in different route except the oral route, and the tablet we use for making solutions. So mainly they are according to the route of administration and their use and the mechanism of action, mainly divided into four types. So first I'm just coming to the first, that is a tablet that ingested orally. The tablet that is ingested orally and mainly divided into how many types? I'm just whatever the types I'm telling, how many types I can tell. So mainly divided into compressed tablets. First that is compressed tablets. Then another one is multiple compressed tablets and sustained release tablets, film coating tablets and sugar coating tablets. Another one is chewable tablets. Those are the different types of tablets that undergoes tablet ingested orally. So I am first coming to the compressed tablets. What is mean by compressed tablet? So let's come to the compressed tablet. What do you mean by compressed tablet? So compressed tablets, they are uncoated. They are mainly uncoated. These are uncoated tablets. They are normally compressed by using the compressing machine. So they are mainly used for the rapid disintegration in the GIT tract. After their disintegration, they get absorbed in the GIT tract and get distribution throughout the body. It's the normal mechanism of those compressed tablets. And another one is multiple compressed tablets. What the multiple? Why is calling it as a multiple compressed tablets? Because there are different multiple layers in their tablets. Why we use it as a, why there are different multiple layers? Because the to avoid incompatibility. This type of tablets are prepared to separate the physical and chemical incompatible ingredients and to produce repeat action or prolonged action products. Yeah, repeat action and prolonged action products. This type of compressed tablets are used to avoid incompatibility. First the ingredients of the formulation except first the ingredients of the formulation except those incompatible substances was compressed first. Then we are taking the incompatible substance and compressed, and we compress it above, means over the compressed compressed tablet whatever I just previously compressed. So it's all about the multiple compressed tablets. A special type of machine are used, mainly the special type of machine are used to compress those multiple compressed tablets. Another one is sustained action tablet. Sustained action tablet means uh, mainly this type of tablets release drugs in sustained manner, means in controlled manner. Whenever the drug releases in controlled manner, that drug will show a controlled release of drug helps to getting the desired degree of action. It will help in desired degree of action. Controlled its maximum release, maximum effect will show. So it's all about the sustained action tablets. Another one is enteric coated tablets. Enteric coated tablets are the main motto of enteric coated tablet. They will just show their action, physiological action in intestine. They show intestine. They mainly bypass the stomach. They mainly show their effect in the intestine. What type of drug? That is anti-helminthic drugs, and what are that is anti-helminthic drugs. Another one is amyloids are mainly used as enteric coated tablets. Another one is sugar coating tablets. Sugar coating tablets, here sugar coating occurs on the upper part of the tablet. Why was just giving a sugar coating? To enhance its quality, or to mask the bitterness and odor of the drug. We are using the sugar coating, and also for protecting the drug from the all the environment factors. So it's all about the sugar coated tablets. Another one is film coating tablets. Film coated tablets. Why we use the film? Why we use film in the tablet? Mainly the main motto in film coated tablet is to prevent the tablet from the environmental factors. It's the only reason behind why we use that film. Why we use the film as a coating is to just protect the drug from the environmental factors. That's all. They are mainly tasteless, obviously tasteless, and less elegant than sugar coated tablet. Obviously, they are less elegant than sugar coating tablets. So, film coating means by using what we are just coating it by using the what polymers. There are different type of polymers we use to coat the tablets. What are the different type of polymers? I'm just telling that some polymers, that is hydroxypropyl hydroxypropyl methyl cellulose, and ethyl cellulose are some polymers that we use to coat the tablets. So finished film coated tablets. Another one is that is chewable tablets. Chewable tablets, mainly we chewed it in our mouth, so it become broken down into the small pieces. So the disintegration time become decreased, and the rate of absorption drug become increased. So what are the drugs that is present in a chewable tablet? Aluminum hydroxide, we use the aluminum hydroxide tablets, and phenolphthalein tablets are the drugs that we use in chewable tablets. So second part, tablets used in oral cavity. What are the different type of tablet that we use in our oral cavity? So first, that is buccal tablet. Buccal tablet means there are some tablet that we use in the side of our used placed. There are some tablet that are placed in the side of the cheek. They mainly absorbed directly into the body by bypassing the first pass metabolism. They absorb directly into the body. They never go to the portal vein and pass on metabolism. They mainly overcome the fast pass metabolism. So another one is buccal tablet is gone. Buccal tablet is gone. Another one is sublingual tablet. Sublingual tablet are mainly placed under the tongue. They are absorbed directly into the body. They are absorbed directly into the body, and then it also has the same motor. It also have the same mechanism. It bypasses the fast fast metabolism. Example is nitroglycerin tablets. Another one is erythritol tetranitrate. So sublingual tablet is the mechanism of sublingual tablet. Another one, troches and lozenges. What is the mechanism of troches and lozenges? These are mainly used to show the local effect. They are mainly used to show the local effect, means antibacterial effect, and antiseptic, antibacterial, and antitussive effect, anti-astringent effect, anesthetic. So mainly this type of tablets, so local effect. So another one, that dental cones. This type of tablets placed in the empty socket. This type of tablet mainly so placed in the empty socket by the removal after the tooth extraction. So they mainly prevent, this type of tablets mainly prevent the growth or multiplication of bacteria by releasing slowly the antibacterial agents or the astringent to reduce the bleeding. These tablets mainly contains this dental cones mainly contains sodium chloride, sodium bicarbonate, and lactose. This tablet get dissolved. This type of tablets get dissolved in 20 to 40 minutes time. So come to the third, tablet administration by other route. Other route means we can implantation tablets. Other route means implantation tablet. So this type of tablets are placed under the skin. This type of tablets placed under the skin or injected subcutaneously. By using gun injector. We are injecting those type of tablets. These implants must be sterile. Obviously, we are just using it, so that to be sterile. These implants must be sterile and should be packed individually in sterile condition. These are mainly used for administration of hormones such as testosterone and deoxycorticosterone. So those type of drugs are mainly used in implantation tablets. Another one is vaginal tablets. Vaginal tablets, these tablets are placed in the vagina. They release drugs slowly, and the mechanism of action means antibacterial, astringent, and another one is mainly release antibacterial agents, antiseptic, and astringents to treat vaginal infections. This tablet also get buffered because our pH should be maintained for their better action. So vaginal tablets gone. Another fourth point, that is tablets used to prepare solutions. Yeah, tablet used to prepare solution. Effervescent tablet. This type of tablet, when came in contact with the water, they release carbon dioxide and effervescent occurs. Effervescent occurs. This should be protected from the environment. Obviously, they should protect from the environment. In the environment, there are water molecules that react and loss it there. mm, Whatever that may be, this will be protected from the environment and kept in tight condition. This will be kept in tight condition. Active medicament. So in effervescent tablet, active medicament plus sodium bicarbonate or citric acid or tartaric acid should be there in effervescent tablets. Another one, that is dispensing tablet. What do I mean by dispensing tablet? That should not be taken orally because it's toxic. We never take it as a dosage form. So whatever, you can use it as an antiseptic, but you can't take it orally. It's because it's so toxic. So given volume of water was added to produce solution. So what are the different type of drug that is act as a dispensing tablet? Mercury bichloride is toxic, and quaternary ammonium compounds and silver compounds. So these are the dispensing tablets. Another one is hypodermic tablet. Hypodermic tablets, these tablets are mixed with some sterile water, and these are mainly used for injection purpose. These are mainly those tablets are mainly dissolved in sterile for injection and administered by parenterally. Obviously, you have to use this parenterally, so that's the sterility should be maintained first. Another one is tablet triturate. Tablet triturate means there's a small tablet. There's a small tablet, usually cylindrical, molded or compressed, and contains a potent medicament along with some mm, dilute. For small scale production, we can use a human operated machine. For large scale production, we can also use automatic tablet retrieval machines. So for today it's enough. I'm stopping this season for today. Let's meet for another. Let's meet in the another video. Bye.